distal radioulnar joint is the second part of the wrist joint. It is the connection between the radius and the ulnar, the long bone of the arm, which come together with the wrist joint, and its function is to allow rotation of the wrist. The distal radioulnar joint is a common site for arthritis. This may be as part of inflammatory arthritis, such as rheumatoid arthritis. It may be part of wear and tear arthritis, such as osteoarthritis, and it may occur as a result of injuries around the wrist, particularly wrist fractures, which may involve this part of the joint. There is another problem with the distal radioulnar joint in that it is prone to instability. It is a rather loose joint and its ligamentous connections can become slack, particularly following traumatic events, and again particularly following wrist fractures, and instability of the distal radioulnar joint may sometimes be a problem. Of course, it is perfectly possible to have both instability and arthritis within the joint, and in fact they commonly exist because of the damage that's occurred to the joint. In terms of distal radioulnar joint replacement, there are essentially two ways in which this could be performed. For arthritis, where there is no instability and the radial side, i.e. the socket side of the distal radioulnar joint is okay, then it is usual to form an unconstrained distal radioulnar joint replacement. There are a variety of these implants available. The one that I like to use is called the Eclipse, which is a hybrid implant being made of both metal and pyrocarbon, which is very slippery and allows good movement. Results with this implant can be good, but it does need the distal radioulnar joint to be stable. If the distal radioulnar joint is unstable and it cannot be controlled by means of ligamentous reconstruction, or if there is significant arthritis within the distal radioulnar joint as well as instability, then it may be necessary to perform a constrained distal radioulnar joint replacement. This is also known as the Shecker implant, after Louis Shecker of the United States, who developed this implant. Essentially what it means is putting an implant down into the centre of the ulna and a plate onto the radius and connecting the two together. This has the advantage of providing both relief from the arthritis and stability whilst allowing the rotation. It is a very successful implant for this combination of instability and arthritis, and is used in all ages, even some relatively young people. It has the complications of all forms of joint replacement, including infection, dislocation and loosening, but overall the success rate of this implant is around 95%. In terms of the practicalities of this procedure, patients usually come into hospital for the day, or sometimes one night. The nice thing about the implant, in terms of the Shecker implant, is that following the operation, once the operation is finished, it is possible to move the wrist quickly without any restriction, so there's no plaster cast and no limitations apart from the fact the wrist is a little painful for a while. And the most important thing is to get the wrist moving under physiotherapy supervision. Thank you.